Okay, so we've been testing this patient in the MEG, in the MEG, and with some sensory motor activity that is elicited by the stimulation of her right hand. And what you see in these different views is basically the MRI of the patient, and the colors represent two things. In red colors, you see the response that is basically normal and to the stimulation and to the sensory motor activity. And in blue, you will be seeing some epileptic activity that is trying to compete basically with the normal brain activity. So the good thing with the MEG is that we have time on our side. We have time resolution that is very accurate. So every half a millisecond we have an image that basically shows us what's the activity in the brain. So again, in red we see the response to the sensory motor stimulation, where we try to map basically the healthy part of the patient's brain that we should not basically remove after surgery. And in blue we see some epileptic activity that is basically competing once again with the normal brain activity, healthy brain activity. So basically the test we are doing in our patients is typically this. It's a contrast between the normal brain activity and the epileptic brain activity. Obviously, if these two overlap in the patient brain, surgery will be extremely difficult to perform, because if this brain area is removed, it's very likely that this patient will lose, in that case, the usage of one hand. But in contrast, like here, when the two territories are maybe very close but do not overlap, there is a good chance that surgery will be successful without any or very little, I should say, risk in terms of the consequences of surgery and the functional outcome of the surgery. So in the case of this patient, this brain area has been investigated by the surgeon, and a subset of this cluster of blue activity has been removed, and the surgical outcome has been very positive for that patient, because basically again with MEG we were able to map out the healthy part of the brain that was functioning with respect to hand coordination and hand motor skills. So once we have identified the regions that might be involved in the epilepsy of this patient and how they compete with the healthy part of the patient brain, we go back to a more accurate view of the patient's anatomy before we get prepared for surgery, and we pass this information to the surgeon. So what you see here is basically an orthogonal view of the patient's head, and we can virtually remove the scalp using some image analysis software and go straight to the brain areas that are of interest. So here in different colors we can easily pick up the hotspot of the recurrent epileptic activity in this patient's brain. So once again, the very important and crucial part in the information provided by MEG is time. So here I'm going to change. What we see is basically a movie of the epileptic activity that tends to propagate from this hotspot here to the rest of this patient's brain. And every image we see here is basically half a millisecond. So this is a virtual movie of the epileptic activity in this patient's brain every half a millisecond, every 500 microseconds. So here timing is very crucial, just because we want to be able to go back to the origin of the epilepsy, and so we want to be very accurate in terms of timing. So we want to be able to pick up and identify the brain regions or the different brain regions that might be involved in the generation of the patient's of the epilepsy in that patient. So if we are not able to go back in time, then we may be fooled by the way epilepsy tends to propagate in somebody's brain. So, but if we go back to the very original time points where the epilepsy has occurred or epileptic events have occurred, then we are able to pinpoint potential areas that are involved in the epilepsy. In that case, we see some areas to the right and another area here more to the left, to the posterior part of the brain. So once we have these images, you see we have coordinates in 3D that can be passed to the surgeon, and these coordinates can be recovered and retrieved, I would say live during the surgery, because the surgeon has what we call a neuro navigation system, and basically he enters these coordinates and is able to know where he is exactly in this patient's brain and basically pinpoint the tissues that we see here as hotspots, as we have identified them using the non-invasive technique of MEG.
And he can also then put the coordinates of where her movement is also, right? Because that's
right.
a big deal too, to know where that is.
Exactly. It's exactly what we've seen before. In the 3D image, you can contrast this epileptic activity with the healthy and normal brain functions like we've seen before in different colors, and therefore we can make sure, the surgeon can make sure that the risk of impairing crucial brain function is really minimized.